Hi, everyone. Welcome back to another episode of the EP Growth Podcast. My name's Chris, Clinic Manager here at Hunter Rehab. I'm excited today to bring you our guest, Mike Blackwell. He's a physiotherapist with 20 plus years of experience in a whole range of settings and different environments. So should be a good chat today. But keen to talk to him about that journey, but in particular, how physios and EPs can work together to get the best possible outcomes for our clients, because we do share a similar space. So with that, welcome, Mike. How are you?
I'm great. Thanks for having me, Chris. Really great to be on the show. Yeah, I think straight into it, really. I think to start off, really, I'm a massive advocate of videos and EPs working together. I've worked with EPs really successfully numerous times in the past, and having just moved to Newcastle from Sydney, that's how I kind of reached out to yourself and Ryan and wanted to connect. And I think that the biggest thing is that that there's I think as traditionally physio has been seen as the manual therapy side of things with a little bit of exercise, but I think that has really shifted over the last sort of 10 years. That physio's moved, and in my opinion, maybe a little bit too quickly away from manual therapy completely. And it's gone the complete opposite into that everything is exercise, which I guess is then when kind of the boundaries may blur a little bit between physio and EPs. I think my personal stance on it is that I know where my sort of skill set finishes, and I know that I can get a patient from a really acute injury, potentially do some manual therapy in that initial few sessions, gradually introducing them to exercise, and I can get them so far with their strength and conditioning and their strengthening work. But I know that the skill set that EPs have can then take them on that little bit, quite considerably further, with regards to maintaining that. And so I think it's really, for me, it's really about having that mutual respect for each other's professions. But I do think over the last few years, there definitely has been the two areas of very much closer in what they do than they certainly used to be. But in my opinion, there's enough patients out there for all of us. And I think ultimately what we've got to look at is that the patient is at the center of every decision that we make. And, I'm not holding on to my patients. I'm not saying, oh, I can't send them anywhere else. I have to realize that, I have a certain set of skills that will get the patient so far, and often we'll get them the complete way, but there's often times where I need some help. And the other example of that is I refer quite often to podiatrists. I refer quite often to women's health physios. So I know that and often the way it works with those professions, and I think it can work similar with the EPs, is that I send them to a podiatrist, or I send them to an EP, or I send them to a women's health physio, and we work together. It's not like my work is done, I'm passing you over. It's we continue to work together, much like in the hospital setting with the multidisciplinary team. I think Nicole brought this up previously. Nicole French brought this up previously. Like, we do it so well in hospitals, but maybe not so well in private practice. So yeah.
Yeah, I definitely agree with that and can see a lot of wonderful points that I want to go over. And I think we can sort of get into a good chat about all of this a bit later into the podcast. But I guess sort of set the scene for us, Mike. Where did it start for you? Without going back too far, but you're based in the UK to start with, and
Yeah.
where did it all start over there?
Yeah, so I trained I'm from the UK, went to Birmingham University, qualified in 2002, worked in the NHS for about 6 years, initially full-time and then part-time, and then worked at a soccer club, Birmingham City Football Club. And that was when they were in the Premiership, actually. So it was pretty exciting time. It was only with the academy and with the occasionally with the reserves and stuff, but it was an incredible experience.
I was going to ask, what was that environment like? I imagine, like you say, it was in the Premiership then, and maybe not now, but to be close to that level, it's going to be a pretty serious organisation with goals and expectations. Like, how did you find that environment?
Yeah, I mean, as I say, I was mainly with the academy and the occasion with the reserves, but you were in the same treatment
Yeah.
rooms as I'm a big Liverpool fan. You were in the treatment rooms with Emile Heskey, who's a bit of a Liverpool legend. And, you know, that particularly only being 2 or 3 years out of university, that was definitely, I just had to kind of detach myself from this guy's an absolute hero of mine to this guy's got a calf strain that we need to treat, sort of thing. So it was, you know, those sort of side of things was interesting. But again, that was where, you know, strength and conditioning EPs, physios work together really closely. Sports docs work together really, really closely because they had to. Like, none of us had this alone had the skills necessary to get that player on the pitch. And, you know, obviously there's a lot of pressure on the physio team, again, more so for the first team, obviously, to get those players on there. And not that I was ever involved in any decision making with the first team, but I was around it and could hear it and could see the pressure being put on when you think of how much money these players are getting paid every week to get back on the pitch sooner. But then obviously the physio was having to go, well, they're just going to re-injure themselves and be injured for longer if we take them back too soon. So incredible experience at such an early part of my career.
Sounds like it would have been really beneficial in shaping moving forward, as we're talking about today, being able to work collaboratively, spit that out, with others in that, the motivation from that standpoint was, we've got to get these players back in the field, the financial sort of having a player on that money off the field. Like, you got to put egos aside and sort of, all right, what's the best thing for this person? And that's sort of, I guess, something you've carried through for your whole career. Is that fair?
Yeah, definitely. I think you know, particularly with it being so early in my career, it really shaped me.
Yeah.
You know, I was also doing private clinics for them as well, which was, you know, again, it was the Birmingham City physios doing private. So, you know, you're sort of regular person getting, you know, elite athlete care. And, you know, those days were huge. Like, and I couldn't ever consider doing a day like this anymore. Like, it was, I'd see like 22 patients in a day, which, like, to me was too many. Like, for me, my good sort of number at the moment where I feel I do my optimal work is between about 12 and 14. I think, but it was a successful business from that. You know, everyone wanted to be seen by the Birmingham City physios.
Yeah.
So the diaries were slammed. So I think, you know, my time management improved from that angle as well. But yeah, it was an incredible experience.
Yeah, it's not really considered. Well, not until you get into it and start doing it. I don't think it's really considered. But the emotional sort of toll on yourself, like, because when you're seeing these people, and they're people at the end of the day, it's not necessarily, oh, that's a strained hamstring over there. It's a person. So you've got to speak to that person, engage with that person on their level, and that could be for your 20 clients a day. That's 20 different sort of emotional experiences you've got to have. That's can be very fatiguing and needs to be considered. So I think for young EPs and physios, any allied health practitioner, it's working out what is that sweet spot for you and having good conversations with your boss, whoever that might be, to like, how can we arrange that? Because that's when I'm at my best. But moving on from that one, when did you move to Australia? So that would have been a very different.
2008. I moved to Australia at the end of 2008 and started working in a clinic. So started working in a clinic January 2009, sorry, in a clinic in Randwick, which was a real sort of grounding for like the experience I got from that. I was, again, pretty fortunate. I applied for a load of jobs. This clinic got back to me and said, "Oh yeah, come in for an interview." Got the job, and it wasn't until I started working there that I'd realised quite the reputation the clinic had. You know, particularly the practice owner. You know, she was on ABC Radio every month talking about physio. She'd been with some of the national teams doing physio in the past, and was pretty well respected and well regarded, and was a bit of a thought leader. You know, before a lot of these things were, you know, proved by evidence, she was kind of already doing them. Well ahead of her time, and again, just learned so much from her. Yeah,
nice. It's certainly a great place to land when you come out here. But and correct me if I'm wrong on this one, but in the UK, does exercise physiology as a profession, does that exist, or is it just called something else? Like,
Yeah, I'd not heard of it until I come out to Australia. I don't know whether it exists now, but I've been here for 15 years. I hadn't heard the term before. You know, I'd heard of strength and conditioning coaches. I'd heard of exercise scientists, but I hadn't heard of exercise physiologists as a term. But I feel like, you know, that I feel like it definitely, the skill set of an EP did exist back in the UK, but I just don't think it was necessarily um,
Yeah,
termed that really.
the awareness and whatnot of it. Yeah, for sure.
Mm.
Because that's what I was going to ask. So you've moved out to private clinic here, and it's a very, very reputable physio clinic. So where did your interactions really start to kick off with EP, for example, and how did that sort of take shape?
Yeah, I think it was, you know, when you first start in any new role, you need to get your diary busy. Obviously, the business has got its own reputation, but you need to build your own. So I was going out, you know, like any sort of practitioner, you know, should, like going out and meeting all the GPs, meeting all the personal trainers, meeting all the EPs, meeting all the podiatrists, meeting, you know, anybody and everyone that would take a meeting with me in the local area that had the potential of building a relationship with, I was getting out there. And I think so that was kind of how it came about. And I think, you know, in that setting that I was at, there was a real Pilates sort of focus. But there wasn't much of a, you know, there weren't, you know, your heavy weights and all those sort of things that I'd been used to utilizing in the UK, and it wasn't as if they were going to get those because nobody else was in the clinic was going to use them. So it was kind of finding somebody that I could then go, right, well, I've got the patient out of the acute phase. I've got them self-managing with a home exercise program, whether that be, you know, body weight, some very light dumbbells, some, you know, cardio involved in that as well. But I need somebody to take them that next level, because otherwise they're just going to be back in 6 months with the same issues coming back. So, you know, I understood that there was a certain patient group that needed that extra assistance that I couldn't offer.
Yeah, nice. Is that where you see EP really coming in to help out the physio approach? It's all right, we've got through the really acute phase there, and we're now gym based or exercise based, and I'm needing you to have more guidance and more, I guess, someone to continue on that part of the journey, and that's when you're starting to look for an EP to come on board and help out.
Yeah, definitely. I think there's a couple of other things as well, like the accountability factor. You know, I could set them up with a program and say, right, off you go and do it. But the accountability factor as well. I think the coaching skills that EPs have got are phenomenal. I think you know, the way that they work out, you know, what patients need and what their belief systems are and all those sort of things, and tailor a program around that. I think that's a really great set of skills that they have. And I think, you know, I think whereas our clinic is usually sort of 30-minute appointments, often I want the patient to have a longer experience with their health practitioner. So I think, correct me if I'm wrong, but where I've sent to in the past has been more like 45 minutes, 60-minute sort of sessions. So yeah, I think you can certainly get a lot more done in that time as well. So yeah, that's kind of my basis really for referral.
Yeah, I think generally, like, it's going to depend on the clinic and the type of session that it is, like what scheme the person's being seen under. But yeah, sometimes like a Medicare based session might be 30 minutes, but then generally it can be up to an hour. So
Yeah.
the time can be more there. But I think what you touched on there was having meetings with as many people as possible, and trying to talk to people and work out who can complement what you're providing. And that's physio or EP. It's not necessarily, well, what do you do that I don't do, but how can you complement what I'm doing?
Yeah.
And then, yeah, let's incorporate that. And it doesn't, you already said this today, but it doesn't have to be, all right, I'm going to do this and then I'll stop and then bring in this person, they can take over. You can really work together to get the best possible outcome. I think that's important to look for. It's a skills-based thing, but I think unfortunately and it doesn't help the whole physio versus EP discussion. There's things like workers' comp at the moment. It's, you can do physiotherapy or you can do EP or you can, there's one. They'll only do one. And so that really does promote the turf war, unfortunately. But
Yeah.
I think it's important that you try and set that aside and look at who can help me here.
Yeah, exactly. And I think, you know, this isn't something new, one allied health professional versus another. Like, you know, the amount of times I get asked in clinic, oh, what do you think of chiros? You know, like that, you know, and it's just like, my answer is always, it's like any profession, there's good chiros, there's good physios, there's good EPs, and there's, you know, there's not bad's probably not the right word, but, you know, I think it's, you know, it's the same in any profession. And I think, you know, again, I've referred to chiros in the past if there's a specific joint that I'm struggling to get to with my manual therapy. There again, I'm happy to admit their set of skills with a good chiro is often better at really specifying that, you know, that one or two joints that need that work on before we can kind of progress. So yeah, it's like any profession, there's good and bad in every profession. So yeah, it's nothing new, I think. And I think it's unfortunate that you know, and it comes from both sides, you know, physios bad mouthing EPs bad mouthing physios, but I think ultimately, I think, you know, both professions have got so much to offer to patients, and even more so to offer when they combine. Like, it's like that whole 1 and 1 equals 3 when you combine the two professions. Like, it's so I just think it's a really useful you know, collaboration.
Yeah, 100%. When I think what you've just touched on there, like EPs bad mouthing physios, vice versa. If we can flip the script there and say, hey, there's a physio over here that I think can really help with this part of your treatment, the getting you from here to here. This is what they're brilliant at, and this is why I want you to see them. That narrative before you arrive can make such a difference, and vice versa.
Yeah.
And you're having the conversation with the person as well. It's like, I want you to go here. We're still going to be working on this, but I want you to go here as well. So through how you're communicating this process, it's going to make such a difference. We need to consider that as professionals.
Yeah, for sure. And as I say, it always comes back to what's best for the patient. And I think if that's your sort of guidance, your North Star, then you're not going to go too far wrong, really, with regards to sort of collaboration.
Yeah, for sure. What are some of the key skill sets that I guess you're looking for in an EP? So if I'm out there and I'm wanting to have a conversation with a physiotherapist, I'm like, all right, how can I sort of appeal to this person? What do I need to do to be displaying, or even what do I need to work on? What are you looking for?
Yeah, I think you can't really initially go past some of the sort of soft skills, you know, the good listener, the empathy, the kindness, the curiosity is a big one for me as well. Like, that sort of growth mindset that, you know, this person wants to improve. They're approaching me because they have realized and they have accepted that there's a part of this patient's needs that I can't meet, whereas I think a physio can. So it's that, you know, leaving that, and again, from both professions, leaving that ego at the door, that, you know, that patient is mine. You know, so I think that's the starting point. Obviously, great assessment and treatment skills from, you know, obviously whenever I send a patient to any other allied health professional, I send them with a handover, and that varies depending on which you know, which profession I'm sending. You know, I've got a podiatrist that I send to that we both do voice memos to each other. I've got you know, I've got another podiatrist that we do letters. I've got another one that I call. I've got another one that I email. Like, it just, and we have that conversation early on. What is your preferred communication model? Because again, if I hate writing letters, and obviously you've still got to do it sometimes, but if I hate writing letters, whereas I'm really great with voice memos or whatever, then again, it's all about what's going to be best for that, you know, that patient. So communication is another one. I think great communication skills back and forth, and not just that initial communication, like a quick text message, you know, 3 sessions into the EP program saying, you know, patient A is doing great. They've done this, they've done that. Pain's dropped this much. Their function has improved this much. And, you know, just that continued communication as well, I think. And I think, you know, obviously in a collaborative model, in a referral model, a two-way street, you know, that, you know, I refer to them, and where appropriate, you know, they refer to me. Like, and it's not like I've got a tally where, oh, I've referred 3 and they've only referred 1 sort of thing. It's not like that, because but I think, you know, obviously we're all trying to build our businesses and build our, our profile in our own spaces. And so yeah, I think that two-way street is important as well. But yeah, ultimately the soft skills for me is the one of the if the soft skills aren't there from the start, I don't tend to pursue it. If we don't click, and I can't put my finger on often what it is, but if we don't click, then often I just go, well, I don't think they're quite right for what I'm looking for, so I'll keep looking.
Yeah, if there's one theme that I think should come through from this podcast, the different podcasts we've done before, is that how important soft skills are. It really does lay the foundation for you to then build the rest of your consult sessions moving forward. Trust and understanding with the clients, so vital. But it's interesting you touched on how is best to communicate, and the fact that you make that very individual based on who you're working with. So I think Ryan did a podcast before with Blake over here at Achieve Podiatry, and loves a voice memo. Just leave me a voice memo. I'll go from there. Not so much on the written reports. And that's brilliant. It's good to know, like listening to what you've just said earlier, in that your number, I think you said, was like 10 to 12.
About 12 to sort of, around about 12, I would say, is probably a sweet spot.
Yeah. So if you've done 12 appointments in the day, and now you've got to try and find time to sit down and write out these reports that no one wants to read.
No, exactly.
Yeah.
Exactly. That's the thing. It's like you write these letters to doctors and you think they've not even opened that envelope. They've literally just given it to, their receptionist to file again. They've not even looked at it, often. So yeah, it does seem a bit inefficient.
Yeah, having those conversations up front just to establish this, like, hey, how do you want to work together here? It can be just parking a bit of ego and, oh, what if they think this and what if they think that? Or just let's have a chat, and then, okay, this is how we're going to communicate. And then all of a sudden working together is so much easier. And I think you just said there, it becomes a referring back to you, or the referrals coming back to you becomes so much easier. Or it should do. This is certainly what we encourage our team here, is that it's not so much of a professional thing. It's a relationship thing. I know that person. I know what they're about. I know what sort of treatment this client is going to get when they go there. And that's where the referral comes from. I think the more conversations, the more you're going to feel that, the better results you'll get.
Yeah. And look, we all find our own referral network and our own people that we're comfortable referring to. And you touched on it before. If I say to somebody, you need to see this women's health physio, you've got back pain or SIJ pain, but you've got 15 years of pelvic floor issues. That I can go so far with my pelvic floor training, but obviously that's not my real sort of skill set. So go and see these guys. They're amazing. Maybe see them for 3 or 4 sessions, come back when you've done that, and then we'll progress. They've already gone in thinking, Mike's really rates these people. He sends lots of people to them. They've gone in with that. This is going to work. This is going to help. Which is a great place to start from, when you're receiving a referral.
It's always nice when, in that initial consult, there's, you've got to sort of, this is how we're going to help you. Like, you're not selling, but it kind of is, right? Trying to sell the outcome to this person. Like, we can achieve this. It's always nice when a lot of that groundwork has already been done for you. It's important on, not just EP physio, but all our allied health practitioners. But if you have been referred someone and the other practitioner has gone out of their way to say, hey, this person's great at this, they can look after you, is respect that. And you don't want to sort of promote a message to that client of, oh, you stay here. Like, that's what you're doing over there is no good. Like, and all of a sudden you're just raining down on all the good work that has been built up. Like, I think that messaging is important as well. You need to respect that process and what the other practitioner is trying to do.
Yeah, for sure. I think that's crucial. Yeah,
for sure. All right, Mike, is there anything else we need to go over today in terms of physios, EPs working better together moving forward?
No, I think we've covered the one thing I did want to talk about. There's in the UK, one of my colleagues at PhysiTrack, he works part-time at PhysiTrack and part-time at the university, and he's been involved with a a project over the last sort of 18 to 24 months where the hospitals are, rather than advertising a physiotherapy role, they're actually advertising a musculoskeletal clinician role.
Right.
And that can be it's competency based and not qualification based. So it can be, whereas previously it was only ever physios that applied for it, they now have it can be sports and exercise therapists, sports and rehabilitation therapists, it can be EPs, it can be osteopaths, it can be physios, and it's worked really, really well. There was that initial, protective over my profession.
Yeah.
This is classically a physio role. Why are we doing this? But I think they've learned pretty quickly that the conversations that they're having about patients is so much more rich. It's not looking at it from that, physio training. That's all I know. That's all I know. That's all I know. Like it's they're getting physio might be chatting with an osteopath about a particular patient, or with an EP about a particular patient, and just again goes back to the patient overall will be the one that benefits from this. So
Yeah.
as I say, it's in the NHS. It's a new thing over the last 18 to 24 months, and it just proves exactly what we've been talking about, that there is a place for EPs, physios, all these other professions to work together, without being protective over their profession.
So interesting to hear that. I was talking to Nadai on a podcast here a few weeks ago and working with the university, and they're bringing out a new program where it's a combined EP physiotherapy program. So when you come out, you kind of
right,
which is super exciting for what you've just said there, that you're going to have a practitioner with the best of both worlds. But I've talked about this before with Ryan. I sort of, we're just talking about this sort of stuff in general. I said, I really think in the future you'll end up with it'll be just called a physical therapist or some sort of name like that, where the qualifications are going to start to merge. I think, I don't know, but they'll start to merge, and then the individual skill sets will be courses that are added on, and then the patient becoming more educated in what they can access start to look for the skill sets that they want rather than the name. So it could be an exercise physiologist that has skills in manual therapy, or it could be a physiotherapist that has, levels up in strength and conditioning and things like that. So you really are looking for, this is the personality that I like with the skills that I like in a location that I like. That's what I want. And it's not just the brand title. So I think that's, I hope that's where it goes, and we can get past this sort of turf or pettiness, I think, for one of it.
Agreed.
Real quick, you touched on there, PhysiTrack. You're working within PhysiTrack. Talk to me about that.
Yeah, so I had my own clinic in Sydney for about 8 years in the CBD, and was growing quite nicely. And then it kind of we got to about a team of 7, and then COVID hit, and being in the CBD, obviously there just wasn't anybody there for a long time. And speaking to people that are still there, it seems like that's still not what it was in the CBD. But yeah, ultimately the business went from a team of 7 to gradually down to just me, to the point where I had to also get some some additional work just to to sort of pay the bills. And I kind of got to, after 2 and a bit years of doing that through COVID, I was just like, what, I think I can't do this anymore. I need to look for something else. I can't keep hoping it will get better. And we had a 10-year plan, and that 10-year plan was to ultimately sell the business. But by the time COVID had got his hands on it, there wasn't really much to sell. There wasn't any team. We didn't have a physical location. We were just renting rooms at that point. So it was time to just cut the cord, really. And I think health tech is something that I've been interested in a long time. I was a big user of PhysiTrack at the clinic. I've been using it for about 7 or 8 years. Clinico, various other, sort of health tech softwares. So I just reached out to them, and after a few sort of back and forth interviews and a few conversations, I started the role with them in October last year. So coming up for 12 months now, and it's been incredible. Like, it's I do 20 hours for physitrack and 20 hours clinical work. Work at a clinic in Merriweather, fitness physio, and it's it's basically, it's a really great balance. Like, it's a really great balance between the two, and loving being in that health tech world, because I know that that's where health is going. And as I spoke about in another podcast I was on, like, it was, I knew that I had to future-proof my body as well, because I'm 42 now, and my hands were starting to feel it, getting a few little neck things from the, leaning over the treatment table and all that sort of stuff. So I was like, I can't be doing this till I'm 65. So it was a good way of future-proofing myself as well, but also just all the exciting things that are going on in health tech, and particularly with the emergence of AI, like, it's only going to continue to be such a valuable facet of health, really.
Yeah, COVID, it seems like a long time ago now, but also not. And I can't imagine what it was like in Sydney. It's a fair bit more densely populated and whatnot than up here at Newcastle. Sometimes you can feel removed from it, but it's certainly started to have a big impact up here. And without going into the frustrations of the lockdown laws and how all of that was applied, but can only imagine how difficult that was for you in Sydney. But certainly physitrack was something we adopted pretty heavily. Like, we were already using it, but the telehealth component of it was something we would really lean into. And I think if you try to look back on it positively, the skills that we had to sort of develop and hone in terms of our online consults, and how are we going to develop relationships and encourage compliance with the program and accountability for clients, motivation, all of those sorts of things through an online platform. I think there was certainly a skill to learn, but physitrack was important in being able to maintain what we were doing. So it still shocks me sometimes. You'll hear from people, oh yeah, my exercises have been drawn for me or written down for me.
I know.
You've got to have a look at something like a physitrack.
I know. It does blow my mind still, and patients love it. Like, the biggest thing, like, it's, one of my concerns about going into the role was, am I a salesperson? Am I this person that's like cold calling every 5 minutes? And I spoke to a good friend of mine who's in sales, not in health, but is in sales, and he was like, look, you're technically selling yourself every 30 minutes with being a physio. You're trying to get that, that person to believe what you're saying is true, and that, believe that you can help them. And that's all it is. It's a relationships role. Like, it's building relationships. It's and it's not like I'm selling encyclopedias. Like, it's a really great product. And when you believe in something as passionately as I do with physitrack, with regards to, patient compliance is the big sort of, that's what I hang my hat on in any demonstrations, any webinars. The improvement in patient compliance with physitrack is just through the roof. And that knock-on effect is, if they're doing their exercises correctly, they're far more likely to get better. If they get better, then they're far more likely to refer their friends, their family, their colleagues, and therefore your business will grow. So that's one of the big angles that I sort of talk about with physitrack, that they won't be coming, we've all had it, where in the past, where you did used to do them on stick diagrams, and they come back and you're like, how on earth did you get that exercise from that drawing? Like, it's just
unbelievable, isn't it?
It never ceases to amaze me. It really doesn't. So thankfully, they can watch that video over and over again, and they can tick their compliance if that's their personality type. They like to tick things off, and I can see that, and I can see, as a practitioner, are they getting any irritation of their pain? I get an alert if their pain level goes over a certain number with the particular exercise. So it's you can nip any problems in the bud before, rather than them not telling you that until a week later at their next appointment. You can see that day one, and you can pick up the phone and speak to them, or message them through physitrack, or jump on telehealth, or whatever it is, which saves yourself a lot of grief down the track, really.
Absolutely. And a neat tie into what we've been talking about today. It's so helpful for me to be able to say, okay, I want you to go and see this practitioner. Take this is what I've given you. This is your physitrack on your phone. It's printed out. That
Yeah.
way they're going to see what we've been doing and have an idea. Okay, that's what we're trying to achieve here. Here's the load
Yeah.
and whatnot that's been set. Because if I rely on the practitioner, on the client rather, like they mean well, but they're going to miss things or they're going to convey
Yeah.
things not quite right. And that just makes everything more confusing. And it can promote the other practitioner going, look, let's just do this
Yeah.
because I'm not sure. So it can be a great communication tool between practitioners as well. But the feedback tool on it where the client is able to message you essentially.
Yeah. Yeah.
They,
Yeah.
I think they really feel fantastic and empowered that they've got technically access to you 24 hours a day. I suggest you put some boundaries in place on that.
Yeah.
They can message you whenever they're doing their exercises. And
Yeah.
yeah, when you check it, you can get back to them and advise. And that way, you're not having huge windows between contact. And I think that in itself promotes what you've just said before, which is adherence.
Yeah. Yeah, that's right. I just think that's the big selling point that I always go down.
Awesome, mate. Look, I think we might call it there today based on time. But where can people reach out and get a hold of you? What?
Probably LinkedIn's the easiest, and it's just Mike Blackwell on LinkedIn. Equally, they can email me at mike.blackwell@physitrack.com. They're probably the two main communication channels, I would say. But would love to hear from anybody if they're wanting a demonstration, if they want a free demonstration, if they're wanting to hear more about PhysiTrack. Would love to hear from them.
There we go. I encourage everyone to reach out, have a chat. Let's make sure we're spreading the good word between EPs and physios and working together. And if you need PhysiTrack, touch base on that as well.
Brilliant. Thanks, Chris.
All right, Mike. Thanks very much, mate. Cheers.
Cheers.